Good afternoon, everyone. Thank you for joining us today. And my name is Lian Bui. I'm a patient and public involvement advisor based at the University of Southampton. And today I will be joined by my colleague Judy, and we are going to talk to you about working with people and community. So we're going to have two sections in our presentation. First of all, I would like to talk about the what, who, and why of patient and public involvement and how to plan for PPI activities in a research project. The second section about costings, PPI delivery, and PPI support available will be covered by my colleague Judy. First of all, I would like to talk briefly about what PPI is. So, public involvement in research means working with or by members of the public rather than conducting research to, about, or for them. So, this approach ensures that research is more relevant, ethical, and impactful. So, why it matters? Involving the public helps researchers understand real-world concerns, improves the quality and accessibility of research, and builds trust between researchers and communities. So I'd like to give here some examples of involvement. So, for example, members of the public can help identify which topics matter most to them, ensuring research aligns with the community's needs. They could also offer valuable insights into how studies are structured, making them more practical and inclusive. So they might also help with creating clear, understandable documents like patient information leaflets and plain English summaries, which can help improve communication and accessibility. Public contributors can also join advisory or steering groups, so they could take part in decision making throughout the research process, in which they could offer ongoing feedback and guidance. So basically, public involvement is not just a box ticking exercise. It's a meaningful partnership that enhances the relevance and quality of research. So it's very important to understand that people involved in patient public involvement are not research participants. Their role is basically different. It's fundamentally different from research participants. So they work with researchers to shape and improve the research process. This might include advising on, for example, study design. They could review materials or help interpret findings. Just to name a few of the activities that they could be part of. So they are basically collaborators, not subjects of the research, while participants take part in the research itself. For example, by completing surveys, they could undergo some treatments or being observed, and their data is collected and analyzed as part of the study. So in other words, PPI is about partnership, about co-creation, co-production, is not data collection or analysis. Recognizing this helps ensure respectful and meaningful involvement. So when we talk about the public in the context of public involvement in research, we are referring to a broad and inclusive group, not just patients. So as you can see on the slide, we include here three different groups of patient and public. So the first one is patients and potential patients. This includes anyone who is currently receiving care or may do so in the future. And their lived experiences and perspectives are really essential for shaping research that is relevant and meaningful. In the second group, we have carers and people who use health and social care services. Carers often have unique insights into the challenges and the needs of those they support. So including them ensures that research reflects the realities of both service users and those who care for them. In the third group, we have people from organizations that represent service users. These might be advocacy group, charities, or community organizations. They bring collective voices and can help ensure that underrepresented or marginalized groups are included in the research conversation. So again, public involvement is about engaging with a wide range of people who have valuable perspectives, not just those with direct patient experience. And it's very important to understand that people involved. So it's very, very important to understand that these include a wide range of different groups of people, just to bear in mind. Right, so next, I would like to talk about why PPM matters in research. So, public involvement is basically rooted in democratic values, and it respects the right of people to have a say in research that affects their lives. So, by involving the public, we also strengthen the ethical integrity of our own work, ensuring transparency, accountability, and fairness throughout the whole research process. People with lived experience bring their insights that researchers might not have considered. Their perspectives help us identify real world priorities, challenges, outcomes that really truly matter to communities. This diversity enriches the research and makes it more inclusive. So public contributors can also help refine research questions, improve study design, and make materials clearer and more accessible. Their input can also support better recruitment and retention of participants and improves how we can communicate with those involved in the study. So when research is shaped by those it aims to serve, it becomes more meaningful. Public involvement ensures that our work addresses issues that matter to patients, carers, and service users, and this increases the chances that our findings will be used in practice or in policy. So funders like the NIHR expect researchers to involve the public meaningfully. It's not just a box ticking exercise, as I mentioned before. It's about co-producing research that reflects real needs. And public involvement demonstrates a commitment to inclusive, patient-centered approach, and which is increasingly valued across the sector. Right, so I would like to talk briefly to you about the research cycle, as you can see on the screen. This one is created by Louise Tang, who is a public contributor with lived experience. So this basically presents some of the stages of the whole research cycle that public contributors could actually take part in. So, for example, in the first stage, identifying research priorities, public contributors could help define what matters most to patients and communities to ensure that research is grounded in lived experience and real-world needs. They could also help with designing the study, give some input on practical and inclusive study design. They could also give some advice on, for example, equality, diversity, and inclusion. In developing study protocols, the next stage of the research cycle, they could review participant-facing materials like consent forms, participant information sheets, for example, to ensure the clarity, accessibility, and relevance of those documents. In conducting the study, public members could participate in advisory steering groups to offer feedback to support ethical and participant-friendly delivery of research. They could also help with analyzing data. They could help with defining outcome measures that matter to patients. They may also assist in interpreting findings from their public perspectives. In terms of dissemination, public contributors can help shape how findings are communicated to the public, to the wider audience, and they could ensure plain English summary, for example, are clear and accessible. They may also co-present at conferences or co-author publications. Regarding implementation, public contributors can provide insights into how findings can be applied in real-world settings, and they could also help identifying barriers and facilitators to uptake in communities or services. In terms of evaluation, they could offer some feedback on the whole research process and its impact. They could help assess whether the research met its goals and also whether the research was meaningful to those involved. So PPI is not a one-time activity. It's a partnership that spans the entire research cycle and involving patients and the public at every stage of the research enhances relevance, quality, and impact. Right, next I would like to talk to you about pre-funding activities. So it's a bit more practical. So before you submit your application, it's very important to involve members of the public in shaping your research. So the NIHR expects researchers to demonstrate that people and communities have influenced the proposal from the very beginning. And this early involvement helps ensure the research is relevant, inclusive, and ethically sound. So you should really aim to involve people in identifying priorities, refining research questions, and, for example, and reviewing materials. Just to name a few of the examples, PPI activities. So this strengthens your application and shows funders that your research is grounded in lived experience. Budgeting for public involvement must begin at the pre-funding stage as well. So the NIHR advises researchers to plan for costs such as contributor payments, travel expenses, and support needs. So my colleague Judy is going to talk to you in more detail about costing in the later section of our presentation. And if you need financial support before funding is secured, the NIHR's Research Support Service may offer advice or small grants to support pre-award PPI activities. And you can also check whether your institution provides any funding for early involvement. And next, the next step is to consider organizing pre-funding PPI activities. So why pre-funding PPI activities matter is because involving PPI representatives early before your funding is secured can strengthen your research proposal by ensuring that it reflects real-world needs and priorities. So when thinking about organizing your PPI meetings, so pre-funding involvement often includes hosting meetings, and these can be in different formats. So you could offer face-to-face it's useful for building rapport and also for deeper discussions. Or you could also offer online meetings, which is more accessible for some, especially those with mobility or time constraints. In terms of types of the meeting, you could offer group discussions to encourage shared perspective and dialogues, or you could also offer individual meetings to allow people for more personal, in-depth input. In terms of your PPI population, you should aim to involve people with lived experience relevant to your research topic. Their insights are invaluable in shaping meaningful and practical research. You should also, you might also want to consider diversity and inclusion. Be intentional about involving people from diverse backgrounds. This helps ensure your research is inclusive and considers a wide range of experiences and needs. Regarding some PPA activities, this might include, for example, reviewing documents, your planning summaries, for example, discussing research questions, or advising on study design. It is very important to note that you are not collecting data. This is not qualitative research, and PPI input is about collaboration, it's not about data analysis or data collection. So thoughtful planning of pre-funding PPI activities helps build stronger, more relevant research proposals and also fosters genuine partnerships from the start. I would like to talk to you a bit more about diversity and inclusion because it's now a condition of the NIHR funding. So, since November 2024, the NIHR has made diversity and inclusion a formal condition of funding. So, this means researchers must demonstrate how their study will address health and care inequalities and include diverse populations. Inclusion must be built into every stage of the research life cycle, from the research question and design to recruitment, methods, analysis, and dissemination. It's not enough to mention inclusion in passing. It must be intentional, well planned, and appropriately resourced. So applicants are expected to submit costed inclusion plans. If inclusion is not adequately justified or budgeted for, funding might not be awarded. And this reflects the NHR's commitment to reducing inequalities and ensuring research benefits everyone. So support is available through the NIHR Research Support Service or the RSS, which can help with planning and costing inclusive research activities. And this is also the focus of the second section of our presentation today. And I would hand over to my colleague Judy. He's going to talk to you in more detail about this. Over to Judy.
So, hi everyone, I'm Judy Joseph. I'm a senior public involvement advisor, and I'm going to start by talking about costings. So lots of people ask us about costing for PPI in funding applications, and this is something that is really important to consider because funding bodies review this and they will check that your costings match up with the activities that you have described in your application. There are no set guidelines on the amount of money that you're expected to spend on PPI, and how much you spend really depends on your project and the activities and the level of involvement you're planning with the people and the communities you'll be working with. So costings for PPI can vary quite widely between projects. Your plans should be appropriate for your research area, and your cost should be proportionate to the planned activities. It's really important to take a pragmatic approach and allocate resources that support meaningful involvement that adds value to your research. You need to ensure good value for money, but also think about what you can realistically deliver within the scope and timeline of your project. Some of the costs you need to consider are listed on this slide. In terms of time, there aren't specific guidelines for reimbursement of time, but there are recommendations. NIHR recommend paying £25 per hour, but you can pay your PPI representatives more if you want to, This is a guideline from them. You can provide options for how people are paid, such as offering vouchers instead for their time. If you're holding online discussions, NIHR recommend paying PPI representatives £5 per meeting to cover remote or home working costs, such as the use of a phone or internet connection to join meetings or printing papers sent by email. When asking people to attend meetings in person, then travel expenses and parking need to be considered, as well as venue hire or contributions to a community space and refreshments. Projects that involve talking to parents of young children or other carers may need expenses for childcare or for caring. And if you're working with people whose first language isn't English, then it might be necessary to translate some of your materials. So you may require translation services and interpreters, depending on the activities that you are carrying out. If you're thinking of ongoing PPI plans and having PPI working with you throughout the delivery of your project, then attending relevant courses and formal training, both for your PPI representatives and yourself, will be really useful. When it comes to costing for PPI, it's helpful to work backwards from your plan. Because there's no set amount to apply for, it's best to first think about what your plan is, who you're going to be working with, where these activities will take place, and what role your PPI representatives will have. And once you know that, you can start to work out how much each of these activities is going to cost and what this is going to look like in terms of the budget. The funding that you apply for won't cover any pre-grant PPI activities, so you'll have to think about identifying potential sources of funding for this. Pre-grant PPI activities are performed before the submission of your grant, and you'll be including details of these activities in your application. When you're identifying potential sources of funding for pre-grant PPI work, if you work in an academic institution, your department might have some funding available for these PPI activities. And you can also apply for funding from an RSS hub. All 8 of our hubs have some funding available for pre-grant PPI work that can be applied for. And you can ask the hub that you're working with for more details about this. So in fellowships, a PPI delivery is slightly different to other NIHR funding streams. The awardee is expected to lead on PPI. So an important difference between a fellowship and other NIHR grants is that you don't have a specified PPI lead in a fellowship. As it's a personal award, you will be leading and coordinating PPI activities. This includes supporting PPI representatives and reporting how PPI influenced the research and its outcomes to NIHR. You might want to consider reaching out to charities or other organisations connected to your area of research to explore if they can support you in identifying suitable PPI representatives. These organisations often have strong links with relevant communities or groups who are interested in getting involved. And in a fellowship, you can involve PPI collaborators who bring their perspectives and experiences. They work alongside PPI representatives to help make their involvement meaningful and impactful. This slide gives some guidance on how to write PPI into your application. PPI needs to be embedded throughout, not just included in the people and community section. And this is to show that it's a core part of the research process, not just something added on at the end. And you need to show the impact PPI have had and how it shaped your proposal. For example, was there something that PPI said that you hadn't thought about and then decided to include? Or was there something that was said that made you change the study design? These are just a couple of examples of what you can include. In your application, there are 3 main sections where you are expected to write about PPI. These are the plain English summary, the detailed research plan, and the people and communities section. In the plain English summary, include how PPI are involved in the design, delivery, and dissemination of the study. The summary needs to include how the proposal has been shaped and will continue to be shaped by PPI. And you'll need to ensure that this is a reading age of 9 to 11 years, and you can involve your PPI in writing and reviewing the plain English summary. In the detailed research plan, include how you will work with PPI in more detail. So any information on PPI should be here, including who has shaped this proposal so far and who will be involved throughout the process. And then you have the people and communities section, which is a summary of how different stages will be directly shaped and influenced by diverse people and communities and the people who will be affected by it. There is a word count limit, so you will have to write concisely. We offer a range of services within the RSS. We are a national group with several hubs, and I'm going to talk about what we offer at the Southampton and Partners Hub. Other RSSs in different areas may offer slightly different support packages. We offer one-to-one meetings to find out what you need in terms of support from us and to discuss your project in more detail and help you plan your PPI activities. We also advise on how to incorporate feedback from PPI into your application. We offer the opportunity to apply for pre-grant funding work with PPI. This is called the peer, and I'll talk about this in more detail on the next slide. If you would like support with delivering your PPI activities, we are able to help you with this for pre-grant PPI. We can help facilitate discussions by attending your sessions either in person if you are local to us, or we can join you online. And we also offer e-reviews where we provide feedback on your application, and we look for elements that a funding panel will be assessing your application on, so we can help to strengthen your application. And lastly, there are additional services that we offer, and these are in collaboration with our wider team who offer support in other areas such as methodology and health economics. A couple of examples of these meetings are research design advisory panel meetings, which are to discuss your study during its development, and mock interviews to help prepare you to be interviewed by a funding panel. You can get in contact with our team to request these services, and please get in touch with us early to allow plenty of time for us to work with you. I mentioned the funding that is available for pre-grant PPI, and this is called the Public Involvement and Engagement Resource, the PEER. All hubs provide this, and while the process and funding amounts may vary slightly between hubs, they are broadly similar. The information on this slide is what we offer at the Southampton and Partners RSS. You can apply for up to £300, and this is offered as a package of support. So we'll work with you in terms of thinking about what your PPI plans are and the development of your application. We offer a one-to-one meeting to discuss your PPI plans, and after the meeting, we send you the peer application form and guidance notes. Once submitted, a decision will be reached within 2 weeks as to whether that money for PPI representatives payment is approved or not.